Imagine feeling your baby move every day, and then, without any warning, your body begins to change too early in pregnancy. This can happen because of a condition called cervical insufficiency. Most women have never heard of it, most don't know the warning signs, and many don't realize it can often be treated if detected early. In the next few minutes, you'll understand exactly what it is, who is at risk, and how modern medicine can help protect both mother and baby. The cervix is the lower part of the uterus, the natural gatekeeper of pregnancy. In a healthy pregnancy, it stays firm and closed until full term, around 37 to 40 weeks. In cervical insufficiency, this support system weakens. The cervix begins to open too early, usually in the second trimester, between 14 and 24 weeks, often without pain and without contractions. That is what makes this condition so dangerous. It is silent. A woman may feel completely normal while the cervix is shortening or opening. If not detected in time, this can lead to late miscarriage or very preterm birth. Certain women have a higher risk of cervical insufficiency. This includes women who have had a previous preterm birth or late miscarriage. It is also more likely after cervical procedures such as LEEP or cone biopsy. Multiple pregnancies, like twins or triplets, can increase the pressure on the cervix as well. Another important risk factor is a short cervix detected on ultrasound, especially when it measures less than 25 millimeters. Even more important than risk factors are warning symptoms. These may include pelvic pressure, dull lower back pain, watery discharge, or light spotting between 14 and 28 weeks. If any of these occur, it should never be ignored. Medical advice should be sought the same day. The important message is this: cervical insufficiency can often be managed successfully when identified early. One of the most widely used treatments is vaginal progesterone. This medication helps support the cervix and can reduce the risk of preterm birth by up to 45%. Another option is cervical cerclage. This is a small surgical stitch placed around the cervix, usually between 12 and 16 weeks, to keep it closed until near full term. There is also the cervical pessary, a soft silicone device placed around the cervix that provides mechanical support without surgery. Along with treatment, close monitoring is essential. This includes regular ultrasound measurements of cervical length, often every 1 to 2 weeks during the mid-pregnancy period. The goal is simple: detect changes early and act before labor begins. There are 3 important steps every pregnant woman should remember. First, understand your personal risk. A history of preterm birth, cervical surgery, or a short cervix increases attention needed during pregnancy. Second, speak up during antenatal visits. Ask directly if cervical length measurement is needed in your case. Third, pay attention to your body. Any unusual pelvic pressure, discharge, or back pain in the second trimester should be reported without delay. Cervical insufficiency is real. Preterm birth is real, but prevention is also real. With awareness, early diagnosis, and proper care, outcomes can be dramatically improved. Share this information with other pregnant women. It may help protect a life. Take care of yourself, because your health protects 2 lives at once. Before you go, I have a special free resource for you. Download our free cervical insufficiency and preterm birth prevention checklist, a practical guide designed to help you recognize warning signs, understand your risk factors, prepare important questions for your healthcare provider, and stay informed throughout your pregnancy. This easy-to-follow checklist can help you take an active role in protecting your pregnancy and understanding when to seek medical attention. Simply click the link in the description below to get your free copy today. Thank you for spending these few minutes with us and for taking an important step toward learning more about maternal and pregnancy health. Education saves lives. Awareness creates healthier pregnancies, and informed mothers make empowered decisions. If you found this video helpful, please like, share, and subscribe to Experts Health Corner for trusted, evidence-based women's health, pregnancy, fertility, gynecology, and wellness information. By sharing this video, you may help another mother recognize